In the GP practice, and specifically to see today Dr. Andrew Whittamore to discuss more about these different inhalers in front of me, and specifically to talk about inhaler techniques. So we are hopefully going to discuss the fast and deep technique, and we're going to discuss as well the slow and gentle technique and the importance of using the right inhaler and the right technique for every specific patient, and as well discussing that in our medicine use reviews as pharmacists, and as well when a patient is on a new medicine service to talk about how to use that inhaler, what's the best inhaler, what's the best choice for every specific patient. So we're going to talk more about it with Dr. Andrew Whittamore today.
Hello, my name's Andy Whittamore. I'm a GP near Portsmouth. Howard's asked me to talk a little bit about inhalers today, partly because there are so many inhalers out there and it's hard to know which inhaler will suit our patients best. The way I tend to look at inhalers is there's two main types. There's the metered dose inhaler, which contains gases, and there's a dry powder inhaler, which contains powders. And actually it's important to know that distinction because actually how the patients take the inhaler really depends on their capability and the type of inhaler we give. Whichever dry powder inhaler the patient is using, you want them to use enough energy to actually release the powder into their lungs. So whichever device it is, you ask them to prime it. They take one expiration first, and then the fast, hard inspiratory flow to try and release the powder. Now that's quite easy for me being younger than many of my patients, but some patients find that easy, and it's important to try different devices with them to see which suits them best. The worst inhaler you can give a patient is one that they can't use properly, so work through different versions to see what suits them best. Historically, I found that patients who are younger tend to get on the dry powder inhalers, but that's not always the case, and I think it's worth assessing patients for different types. Dose inhalers tend to contain gases, so what we need to do is help the patient to encourage the gas down into their lungs with a long, slow, gentle breath. This involves much harder coordination sometimes, but if I just demonstrate how we do it, you set off the inhaler ready to go, expire. A very long, slow, gentle inspiratory flow there. Obviously, if patients are struggling with a metered dose inhaler, there's also always various spaces that you can use to make that a bit easier. And that also works for devices like the Respimat device as well. So a long, gentle inspiratory flow. One way that you can actually check whether a patient's got enough inspiratory flow or getting the right flow, and even helping to train them, is actually with an inject device, and there's actually different versions of this on the market now. Example is for example, if a patient's using the turbohaler, you can find the setting for that on here. You've set the machine right, and you ask them to breathe in as hard and as fast as they would do normally. And then it actually gives you a reading of the resistance they've generated to try and activate the powder in their inhaler. According to this, I've just managed 60 litres per minute, which only just fits in the recommended levels for the turbohaler. So interesting when you're evaluating the patient, actually gives you an objective way and actually shows them how hard they should be doing. It's also very instructive for people who are actually prescribing inhalers as well, to know what their patients should be able to do. There are new versions on the market, and actually there's different settings for different inhalers.
So thank you very much for your updates and for your time. I know it has been a very busy day as well. And I really appreciated a lot of your time and giving us the updates about the inhalers and the techniques, which is a very important thing to consider in community pharmacy.
Thank you for coming and spending some time with me today. I think it's an important step having pharmacists working with GPs more closely, and even in the practice as well. And as many of the viewers will know, is that actually out of the top 5 expensive drugs to the NHS, 4 of them are actually inhalers. So if you've got people who aren't using them right, or using them correctly, or using them often enough, then actually that's a massive waste to the NHS. So there's massive improvements for what we can do there. As I've been through, there's a couple of types of inhalers, dry powder and metered dose inhalers, and actually patients need to know how to use them correctly. There are different ways of actually evaluating whether the patient's using it, and that's actually watching the patient, talking them through it, and maybe even using something like the inject device to see if they've got enough puff or flow to actually make that work well for them. The other thing patients can benefit for is there are obviously trainer devices. These ones just for the turbohaler and for the elliptic device, and actually give out a whistle so the patient knows they're using it correctly. And there's various other devices out there that can help patients use their inhalers properly. I always actually advise patients to go to the Asthma UK website, especially those with asthma, not just for the information and educational support, but actually there are actually educational videos on there about how to use their inhalers. So if they forget what I've shown them or what you've shown them in the pharmacy, then actually they can go home and refresh themselves at any time they like. But I think whenever you are doing a medicines use review, or you're assessing a patient, an asthma review or a COPD review in a surgery, it's very important to actually watch them use an inhaler and actually make any corrections as you can. And actually, if it's not working for them, find a different type. There's plenty out there. If that's a more expensive inhaler, then if they're using it right, that's not a problem.
Yeah, I agree. I think so. It's very important to find the right inhaler for the right patient and using the right technique, because, I mean, as you said, it's the way that the patient would like, would favour. And there's many on the market.
Plenty to choose from.
Thank you very much.
Thank you.